Ever since I qualified as a mental health nurse, I've been a member of the RCN, but I wasn't particularly active. It was only when I could see things that could be better around me that I thought, well, you know, who's looking after us nurses? And then it quickly dawned on myself that we need to look after each other.
It's really tough out there, and there's a lot of pressure and people are feeling quite stressed at work. So we are actively trying to recruit more safety reps because they've got such great value.
I always thought of Catherine in particular and her colleagues as well as the eyes and ears of the Health and Safety Committee on the ground, because there were so many important areas that they brought to our attention.
I think it's important to have representation on the Health and Safety Committee, really from all stakeholders in the Health Board, and one of the most important stakeholders is the staff.
So a typical day for me is a bit of office and out and about really. So office-wise, I would check emails, phone calls, answer individual queries from members about health and safety issues. Hello, Catherine speaking.
Hi Catherine, it's Sam here. How are you?
Hiya Sam, I'm fine.
Aside from the peer support that I get from Catherine, I found the support that I get from RCN Wales extremely helpful.
I would also have a chat with the stewards about what cases they've got going on at the moment, and then try and input with health and safety there.
Got a member who's having problems getting equipment for bariatric patients.
And that's why it's so important that the staff provide us with the feedback as to what's going on a day-to-day basis, because we don't want to have to wait until an incident occurs before we actually do something about it.
Going out and doing workplace inspections is a big part of my role.
I find having someone who is on the staff side representing the staff, also working collaboratively with me, is a great help, because not only does it help problem solving in collaboration, we sort of sort out many issues.
Another area that takes up a lot of time are meetings.
Health and safety is too important of an issue to have any inter-union rivalries.
Well, there's nothing more important than the clinical safety of your community.
In terms of encouraging safety reps into the role, I think there is a fear that they're getting into something that they don't know. Well, actually, they're being appointed because they have all that base knowledge.
You ask a nurse to walk into a ward and tell you their gut feeling about whether it's safe or not, and they'll be able to tell you.
When I see a member who's going through a difficult time, I want to do as much as I can to support them through that, because they do such a fantastic job looking after the general public. I want to do a little bit to help look after them.